Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Haloperidol. Its brand name is Haldol. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? First, we'll talk about how haloperidol works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons a patient could not use haloperidol. We'll then discuss examples of dosing, followed by side effects. So how does haloperidol work? Well, first of all, haloperidol is a butyrophenone antipsychotic with a mechanism of action that is not completely understood. However, we do know that it non-selectively blocks postsynaptic dopaminergic D2 receptors in the brain. Now, in terms of indications or reasons we would prescribe this medication to a patient, we often see it used in schizophrenia. It can be used to treat hyperactive behavior. This would not be as a first-line therapy. We see it used in Guillain-Barré syndrome, as well as in severe problematic behavior in children. Again, not as a first-line therapy. Now for contraindications, or reasons we would not be able to prescribe haloperidol, the first would be if a patient had a hypersensitivity to haloperidol or to any other component of the formulation. It would not be able to be given to a patient in a comatose state. Patients with Parkinson's disease cannot use this medication. It would not be given to patients who have severe toxic CNS depression, and also wouldn't be given to patients who have dementia with Lewy bodies. Now, what about dosing with haloperidol? So in schizophrenia, or Tourette syndrome, we would typically see 2 to 5 milligrams given intramuscularly. This dose can then be repeated every 4 to 8 hours based on the patient response. And the maximum dose would be 20 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using haloperidol, so I'll go over some of those here now. First thing, patients may experience extrapyramidal side effects. So some examples of these would be a tremor, slurred speech, akathisia, anxiety, distress, or paranoia. They also may experience increased muscle tone or somnolence. Now, some more rare but serious side effects would be prolonged QT interval, a pulmonary embolism, or a seizure. That's all we're going to talk about today in this brief presentation on haloperidol or Haldol. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.